And the big thing I want to talk to you about is lockdowns. Now, Boris is in a world of trouble because of this ludicrous Partygate nonsense, and it may well defenestrate him ridiculously. But let's assume he survives. I think he, in the fullness of time, fairly soon maybe, he's going to have some serious questions to answer about lockdowns. Now, I said at the beginning of the show, I'll forgive the government the first lockdown back in March 2020. We're in uncharted territory. The death rate was going up. We didn't know what was going on. So I really don't blame the government for going into lockdown. And I don't have any truck with that nonsense about they took too long to do it. We were in a difficult area and they locked us down because they didn't know what was going to happen. I'll allow that. So I can't remember exactly how long we were in that lockdown, but a month or so. 6 weeks, whatever it was. We came out of it, and guess what? The case rate started flying up again, but death rate went up again. So it was pretty much proved at the first lockdown in terms of preventing deaths, the spread of the virus, hospitalizations had not worked. So why did he put us into another one? And another one, and another one, and another one. Why did he do that? We know why, because SAGE and their little models, their epidemiological models, were spooking him. He's got serious questions to answer about that, because epidemiological models should not dictate public health policy.
No, and I actually think there's a bigger point here, because I did some work on this today, and I actually had a look at what people were suffering by the end of the first 3 months of that lockdown, the very first one. And it was very clear at the end of that 3 months that the catastrophic effect that the lockdowns were having on all other health conditions, so much so that by the first 3 months there were 5,000 missing heart attacks from A&E. So that's the number of people who would have normally turned up to A&E having a heart attack, needing treatment, needing their lives saved. Now, we've got no reason to believe that people stopped having heart attacks. So did those people die? Where were they? Strokes turning up at A&E were 12% down, and there were 3,500 predicted avoidable cancer deaths over the next 5 years by the end of July 2020. So notwithstanding that damage, which would see over the next decade many more people die of the lockdown response than actual COVID itself, we carried on doing it. So when we got to September of 21, there were up to 750,000 missing GP urgent cancer referrals. 750,000. The estimates now are that there are 60,000 fewer cancer treatments started as a result. Now, these people are going to die over the next 5 years. They're not going to die next week. So we are going to be dealing with the results of lockdown. And this was always my fear. This was what I wrote about as early as April 20. We were going to lose many more lives to this than we lost to COVID. And I know this is also a thing that people don't like us to say. Those lives are younger. They're younger people. They're 50, 60. They had another 30 years of life. They weren't 82 and at the end of their life, and we saved 6 months for them. And we have to be brave enough as a society to say, hang on a minute, we have to look at all lives and how much life someone has left.
Indeed. So the former Brexit minister, Lord David Frost, said last week, he revealed, there were stories saying that he left the cabinet and quit the government because he didn't like the direction of travel, didn't think it was conservative enough. Last week he kind of shot that down. He said, no, I left the government because of the Plan B restrictions. He said they were utterly unnecessary, and I told Boris, but he wouldn't have it. And he also said, when we look back, he said, I can't remember the exact quote, but it was pretty much something like, the lockdowns will be seen as the most catastrophic policy mistake, or probably in the entire history of this country. Now, as I say, I can forgive them the first one, but why did they keep doing it? Now, don't forget, what are we on now? Oh, it's January the 20th. According to Neil Ferguson, in his prediction last month, we should be having about 6,000 to 7,000 deaths a day right now. I think it's running along at about 75. We had Chris Whitty at the beginning of December saying we don't know much about Omicron, but all we do know is bad. Wasn't true. All we knew was good.
Yes.
We had the South Africans screaming at us, Dr Angelique Coetzee, who discovered Omicron, screaming at Boris and Britain, publicly saying, you're overreacting. Professor Sir Graham Meadows, part of SAGE, one of the modelers, if you like, the boss modeler, he was actually quoted in a massive piece in the Daily Telegraph at the weekend on Saturday, he actually said this. Now, he is a modeler.
Yeah.
He said, should epidemiological models dictate public health policy? No, absolutely, they should not. So why did they?
Why did they? Was it because our pandemic planning was so inefficient and spread all over the show that we just didn't know how to react? Was it that there was something else coming from the WHO and the World Economic Forum that all countries then acted the same? I don't know. I looked at an amazing graph today, which was all of the states across America and their virus increases and decreases. Every single state had a different approach. Some of them locked down rigidly, as we know. New York is like a police state now.
What's the best state over there now? Florida, which never locked down.
But actually, the more interesting thing, so because people will always argue, different population, different build-up, the more interesting thing is just seeing what their virus did on the graph. And every single graph is identical. The virus goes up, the virus goes down, because that's what viruses do.
Yes, indeed. So, the Plan B restrictions, I mean, I know that he just sort of got rid of them yesterday with a kind of alacrity, and I'm glad that he did. But he knew that was an easy thing to do because deep down in his heart of hearts, he knew that he didn't have to bring them in the first place.
Yeah.
Why did he do it? I mean, I don't think we should let him off the hook for this stuff.
I don't think we should let him off the hook because what people don't see, and I think this is what people really don't understand, is those hospitality businesses that are going to go to the wall because of what he did, and the people who are going to lose their livelihoods and then be plunged into poverty along the way as the standard of living goes up as well. They will suffer ill health as a result because poverty breeds ill health, and it will go on for decades. So just as we've destroyed our children and their education, we're also destroying their lives in other ways by taking money out of the hands that feed them.
Yeah. And don't forget, in order to fund the furloughs, the hugely expensive furloughs, and the economic turmoil that we were going through, the government printed more and more money, quantitative easing, and that is now beginning to trigger kind of almost astronomical inflation, 5.4% or something, and rising. Now, this is going to be untenable. So people are going to find out the effects of the lockdowns in the next few months, because this is when we start paying for it, folks, and you're not going to like it. So tough times. We're going to go to break in a minute, but I want to ask you about this. Sajid Javid told Julia Hartley-Brewer on Talk Radio this morning, COVID is here to stay. I've got some news for you. There will be many more variants. Yes, there will, Sajid, and each variant will be milder than the last one. I mean, why is he telling everyone still to get vaccinated when all the indications are that COVID is on the way out? All the statistics are plummeting. Every region of the UK, hospitalisations are down, deaths are down, case numbers are down. What's this obsession with get your booster? What against what? Omicron. It makes you a bit sniffly for 2 days. Don't need a vaccination against that, do you?
It's really bizarre because we've got some good data from Israel this week, who are always ahead of us in everything, because they're ahead of us in this COVID virus and their vaccinations. And they actually said very clearly this week that whilst the booster seems to push your antibodies up a bit, it doesn't stop you getting Omicron. Omicron is beating the booster. People are getting infected. I'm seeing that in GP. I'm seeing people with no vaccine, 2 vaccines, 3 vaccines. They're all getting Omicron. They're not getting sick. I'm not sending them to hospital. Yes, there'll be some people who go to hospital, but that will always be the case for some people, even if they get a cold.
Have you seen people who've had 2? Because I heard that there was a doctor on Ian Collins' show today saying that if you got Omicron and you've just had 2 vaccines, you could get very, very ill. Mm-hmm. But if you had the booster, you'd be fine. No. I mean, is that true?
I'm seeing the same illness across everybody that gets it, because I think the vaccines 2 or 3 are not having any difference, so they're getting the same illness that they would have got.
And even if you haven't been vaccinated, Omicron's not going to kill you, is it?
No, so my daughter-in-law got Omicron before Christmas. She is unvaccinated. That's her choice. I respect it.
Yeah, of course.
And she said she felt very flu-y for 2 days and then she was fine.
Yeah, I had a friend who's not vaccinated as well. Same thing. He said frankly it was the sniffles for 2 days.
Yeah.
So vaccine or not, I mean, they're trying to say, if you get 2 vaccines and the booster, it'll really save you from the worst of Omicron. But there's no such real thing as the worst of Omicron. It's not that bad, is it?
Look, it's always going to be bad for some people, Kevin, and that's always
with
the worry.
Omicron, not. You see what I mean?
Could be, yeah. So for some people, it doesn't matter what they catch, they're at risk. People with COPD, people with cancer, people immunosuppressed. And, we have to look after those people, which has always been my argument. But for everybody else, for you and me, it's a cold. It's another cold.
I had another guy calling Ian Collins this afternoon, and he said, I've got Omicron. I've never felt iller in my life. I'll tell you, it's a very, very serious condition, and I've never felt worse. Yeah, you're so ill that you picked the phone up and phoned Ian Collins.